First, I would like to thank the Glanzmann's Research Foundation for asking me to come speak today on a topic that I hold very near and dear to my heart. As a physical therapist, I speak to my patients all the time about promoting safe and effective physical activity. And that's what we're going to talk about today. Again, my name is Kristen Benya. I am a physical therapist here in the Boston area. I work in an outpatient center associated with Brigham and Women's Faulkner Hospital. And I've had the pleasure since 2017 with working with the team at the Boston Hemophilia Center in the adult clinic. Since March of 2019, I've also been a member of the Physical Therapy Working Group through the National Hemophilia Foundation. I have no financial disclosures or conflicts of interest with the material in this presentation. Here I have listed some of the learning objectives for this talk. So this is what we'll be focusing on today. Why maintaining healthy joint and muscle function is so important with those who have a bleeding disorder, how physical activity can positively impact cardiovascular and bone health, and the positive effects of regular activity on mental health. Finally, we'll explore the different tools available to this community to begin or expand our wellness journey. Here I've highlighted some of the main outcomes of inactivity. We'll speak to each of these individually during the talk. Briefly, if we are often inactive or have the inability to move regularly, we can see a decrease in muscle strength, joint mobility, and muscle length, which can greatly impact joint and muscle health. If we're not moving around, we have a higher risk of osteopenia, which can lead to osteoporosis, and an increased risk of fractures. We also find in the bleeding disorders community, if we're not moving around regularly, we're at a higher risk of joint and muscle bleeds. Physiologically, we see changes, negative changes with inactivity like weight gain and obesity, increased risk of cardiovascular disease and type 2 diabetes, and there's even an association with a higher cancer risk for some cancers if we're not moving our bodies regularly. And finally, psychological impacts of inactivity are vast. We see people becoming more socially isolated, having poorer performance in school and professional life. And we also see a higher incidence of depression and anxiety with those who don't feel free to move as they want to. All of these negative outcomes of inactivity can have a greater burden on those living with a chronic disease. In this realm of physical medicine, this is a major health equity concern that we can address with the spread of knowledge and targeted interventions. We'll begin our discussion with the musculoskeletal system. And here we'll just lay the groundwork with this slide for what's happening inside our joints. On the left here, you'll see a healthy joint. So we'll start from the inside out and just touch on each component of the joint as we go. First, we have the cartilage, which is that articular surface of the joint. It's a nice, smooth surface that allows the bones to move freely on each other as we walk around, reach for things during our everyday activities. Next, we have the synovial fluid, which lubricates the joint. It contains nutrients and also helps with the flow and uptake of waste products in our joint. It also helps aid in shock absorption when we're running, jumping, or doing anything active. Next, after that, we have the synovial membrane, which forms the capsule around our joints and creates that joint space where blood can sometimes collect after injury. This synovial membrane also creates the synovial fluid and helps with that reabsorption of waste products. And finally, I just want you to take a look at the bone and look at that nice, proper bony matrix where we have that solid material that we kind of bear weight through and gets us through life. We also have passive and active structures that act on joints. Some passive structures would be ligaments that attach bone to bone. Some active structures would be the muscles and their associated tendons. So what happens when there's trauma to a joint? On the right here, you'll see a hemarthritic joint, where with either trauma or an acute bleed, blood enters that joint capsule and it causes physical stress on all of those structures we just described. This sparks an inflammatory process in our body, which is our body's way of trying to fix a problem. We got to get there, get all that blood out of the tissue. So first, the synovium, that lining around the joint, sends out cleaner cells called macrophages to remove those blood products in the joint. And that's good and bad, and we'll talk about some of the negative side effects in a moment. This blood also stresses that synovial lining, and it presses out against it, causing a thickening and a synovitis response. When this happens, can lead to thickening of that membrane, and it can more easily bleed in the future if we don't stop these cycles when they start. Coming down into the cartilage, that articular surface again. With blood contact and those macrophages trying to do their best to clean blood out of the joint, it can also start to degrade the cartilage itself, which we don't want. And then finally, the bone. You'll see here, there are some bone spurs, some osteoarthritic changes going on, even some bony cysts and osteopenia where that matrix is starting to break down. The pathophysiology is not crystal clear with these processes, but what is assumed is with that loss of cartilage, that lining that protects the bone and is meant to bear weight through that joint breaks down, as well as the decreased weight bearing and load on the joints because of those bleed episodes where we got to be out of commission for a while. We feel like that is a major factor at play with some of this bony degradation. Okay, so how do we avoid this? Well, certainly starting with a gentle activity, exercise, or leisure movement patterns can help. We want to avoid those situations that we talked about previously, and we can start with some strength and resistance training. So what does this do to those active structures we were talking about that help support the joint? It can improve joint stability and protects those movement patterns. It can improve the tolerance to load or stresses on those joints. And the stronger and more resilient those muscles are, we can recover quicker if we do have bleeding episodes, where our bodies are ready to get back to that regular range of motion and strong movement patterns. Flexibility is also important with our muscle structures. If we're too tight, we can start to increase our risk of straining muscles or even bleeding into those muscles. So we want to practice those flexibility exercises with either yoga or regular morning stretches. Maintaining proper muscle flexibility also improves our body's ability to understand where it is in space, or joint and muscle proprioception. When our muscles are too stiff, especially our lower extremity muscles, and we don't have full range of motion of our ankle joints, we're at a much higher risk of falls, especially as we age. And finally, as I've just said, it improves joint mobility. With tight muscles, if we're limiting that amount of motion that our joints can bear weight or move through, we have a higher risk of kind of wearing out those joint spaces there. Now, I'm an adult physical therapist, but I want to highlight an important piece to the pediatric population when it comes to movement and muscle health and physical activity. There are major motor skill milestones that children and adolescents need to reach as they move and grow. Things like rolling, transitional movements, and all the components of our gait cycle need to be practiced. This can often be missed in patients with bleeding disorders if there are repeat bleeding episodes or suggestions of inactivity. Don't let him roll around, don't let him do what he needs to do. And with those missing of motor milestones, we have a lot of negative side effects on the back end that we'll talk about. Now we'll move on to some of the passive structures of the musculoskeletal system and how physical activity can impact those. I just wanted to illustrate a simple bone remodeling cycle, how we achieve proper bone mass. Once we hit our late 20s, we've achieved that maximum bone accumulation. Our growth plates have closed, and we're now shifting into the maintenance phase of our bone health. Over time, as we move around and age, some of the old bone structures are weakened and reabsorbed by osteoclasts, and new bone is formed in their place thanks to this cycle. Weight-bearing activities, proper nutrition of vitamin D and calcium consumption, all of these inputs stimulate calcium deposition and activate those bone-forming cells called osteoblasts. So like I just said, nutrition, physical activity, both play huge roles in this cycle and are components of your daily life that you have direct control over. Here I'd like to take a slightly deeper dive into variables that can impact our bone health. First and foremost, walking. Putting weight through bones to create and promote that cycle we just discussed. Now, oftentimes, many people can participate in that, but sometimes we can't for various reasons of safety concerns or injury. There's new vibration mats that are out, which I personally have never seen, but some of my patients have been starting to see in gyms and other PT and rehab settings. Now, these are still very new and the research is ongoing, but there are some promising studies right now showing the slowing or even stopping progression of bone loss in postmenopausal women. So these could be good options for people who might not feel comfortable either walking in their community or participating in a strength training activity, but just starting the process of engaging in some bone health practices. Adequate nutrition, we've already discussed, with vitamin D and calcium being a really important part of this bone remodeling cycle. And again, coming back to walking, there was a recent study with men who have hemophilia A who were issued a treadmill walking routine that kept them about 65 to 75% of their maximum heart rate, which would be that moderate range of intensity. And after 6 weeks of this routine of 3 times a week, showed improved bone metabolism markers. They also, another piece to this study was incorporating a combination exercise routine with the treadmill walking and a light strengthening routine in a gym. And that was seen to even be more effective at remodeling bone and improving the stability of those joints. One other piece to this slide I'd like to just bring everyone's attention to are those peak bone mass graphs. So here, with proper nutrition and activity, we can hit that higher bone mass peak than those who either don't have access to proper food or nutrition, make poor lifestyle choices like smoking, or and not having that proper level of activity. It sets us up for that lower bone mass in general, and we're constantly having to kind of keep up to at least maintain that level. People living with a chronic disease often have a steeper hill to climb when it comes to daily and long-term stressors, anxiety, and overall mental and emotional well-being. This is a critical component of their healthcare, and in my opinion, can be a big part of the conversation around their physical activity. I want to briefly highlight some of the benefits of activity that has on our mental health based on mountains of research. Now, this is by no means an exhaustive list, but I think it's a really inspiring place to start. First and foremost, movement, activity, walking helps improve brain health and performance. We see higher levels of attention and processing speeds. We can retain information more easily. And it's even been shown to reduce the risk of dementia and cognitive decline as we age up to 30%. With an active lifestyle, we tend to improve our sleeping habits. We see improved duration of sleep, quality of sleep, and it decreases the time it takes people to get to sleep. Studies show that regular, moderate exercise can extend all of the, or improve all of these markers. Stress. I have been exercising a lot this week in preparation for public speaking, which is not my favorite thing to do. And I can attest to this. It has definitely improved my ability to cope with an upcoming stressor, and respond to mental challenges during the week. All of this happens at a neurochemical level. We can see these changes. It decreases the body's stress hormones like adrenaline and cortisol that get us all amped up, and improves our mood elevating chemicals like endorphins. There's some really interesting animal studies going on right now that are looking at aerobically trained rats and their ability to tolerate stressors, mental stressors, physical stressors. They're looking at this neuropeptide that is produced after activity, improving their resilience and decreasing those stress levels too. Next, it helps reduce anxiety and depression. With control of those stressors and how our bodies respond to them, it can improve our ability to tolerate anxiety and decrease those levels. Some studies have even shown exercise to be as effective in treating mild to moderate depression as common pharmaceutical interventions, where we're avoiding some maybe negative side effects of those. And finally, it just makes us a little bit happier. After doing physical activity, maybe participating with a friend during that, it just helps our self-esteem. It improves our ability to be social and stay active in our community and our families, and can even improve our confidence and self-image. There was a gym-based exercise study, again, with men who have hemophilia, where after a strengthening routine for 6 weeks with, I think it was 30 study participants, every single one noted improved self-efficacy, which in this scenario meant a decreased fear of injury or bleed, and less perceived barriers with their chronic condition, improved self-esteem, and a distinct move from the contemplation phase of should I work out to action and maintenance phase. They had that support of their fellow study participants. And what the study researchers didn't really anticipate, but was also seen, was the social bonding aspect of the group, where they chose to continue working out together after the study completed. So here, we're shifting gears now to the cardiovascular impacts of inactivity, and specific to the bleeding disorders community. Recent studies have been showing a distinct increase in levels of obesity and weight gain in our population. This can start to lead to reduced mobility, which slows the metabolism, which creates this negative feedback loop, which we would like to avoid, because more weight on joints makes joints crankier and more likely to bleed. We also see this correlation between high blood pressure and these components, where some studies have shown a twofold increase in risk with patients who have coagulation disorders. Inactivity in general can lead to atherosclerosis, which is about the same burden as the general population when we're looking at that. And our populations are living longer, which is a great problem to have, but also comes with some age-related cardiovascular risk factors like high cholesterol and diabetes. I want to make note of some challenges to treating cardiovascular disease if it does occur in coagulation disorders. The core treatment for these issues consists of antiplatelet therapy, which can further increase the bleeding risk. So with our patients, we need to have such a comprehensive care team approach when and if these diseases do occur. Okay, so how do we avoid all that? Because we don't want it. Physical activity can address many of those issues, starting with vascular compliance, or our vessel's ability to accept load and stress from our heart pumping our blood through our system. This increases the elasticity of these vessels, improve with regular physical activity. This improves our blood pressure. Respiratory, heart, and diaphragm strength all improve with regular, moderate physical activity. With increased heart strength, we get increased output into our system, perfusing our tissues with blood that they need to do their jobs. A stronger diaphragm helps it descend lower into our abdomen, filling our lungs with more air, getting us through the day a little bit more comfortably. Physical activity helps decrease cholesterol rates in patients who have less plaques, decreased blockages, less risk of stroke. That's always a good thing. We also see a decrease in inflammatory markers, which are linked to cardiovascular disease with people who regularly exercise or participate in walking routines. There was a study with patients who identified as overweight or obese who also have hemophilia, where the intervention was a 45-minute exercise program, strengthening and aerobic and strengthening program, 3 days a week for 6 weeks. Each participant saw a significant improvement in waist circumference, waist to hip ratio, BMI, overall weight, and a decrease in those negative inflammatory markers. Again, they saw a connection between the aerobic and strengthening exercise combination being the most effective at this. So we're starting to see a little bit of a pattern where we need a little bit of everything to really see the most benefits. With exercise and activity comes weight loss. Going back to that decreased load on the joints, less stress could lead to less bleed risk. And then finally, regular exercise improves insulin sensitivity, with diet and exercise often being the first prescription that doctors will go to try to decrease those levels of high blood sugars. So this is a busy slide, I'm sorry. But now the question is, how much do we do? Like what's the magic number of minutes, hours, what to get all these benefits? So I'd like to start with the World Health Organization's guidelines. They updated these a few years ago in 2020 and made note to start to incorporate many different chronic disease populations within these guidelines and how we can achieve the same benefits without increasing the risk. So here I've kind of highlighted this center section where most of the population, including those with bleeding disorders, should get 2.5 to 5 hours per week of moderate or 1.5 to 2 hours of vigorous exercise per week. They're also very direct about saying muscular strengthening and weight training exercises should also be incorporated 1 to 2 days per week. So how do we know what's moderate and vigorous? Oftentimes, that's linked to heart rate response based off of your maximum heart rate, which is a little calculation we can do. And it's also rate of perceived exertion, where we have this scale in physical therapy where we determine how hard an activity feels. So it's very specific to each individual, which is going to be challenging during this talk because I have no direct answers, but there's lots of different answers. So hopefully that will kind of inspire people to think of what they enjoy and how this can be integrated into activity. Again, this is just a starting point. Each activity routine is specific to physical ability, needs, and the goals of the individual. And it's going to look different for everyone. So who can help us with this? So many people can help us. I wanted to put this slide up just to show you how many organizations specific to our bleeding disorders there are that have a fount of knowledge and physical activity, safe ways to participate, and obviously a million other pieces of information. It's always good to be an educated consumer, and our healthcare is no different. I'm going to focus most on the National Hemophilia Foundation's website. They're making a targeted effort to be as inclusive as they can with any bleeding disorder. And I think their name is changing soon too. I think it's going to happen in a few weeks. But anyway, so here I've highlighted some of the website's more activity-specific suggestions through their Steps for Living program. They separate their education modules and each stage of life, starting from birth all the way up through old age. Here in the center, you'll see the kind of active kids do better in everything slide, where we see all the improvements that just regular physical activity can impart. And then on the right, you'll see the do the fives in the more mature patient who has to think about things like vaccinations, nutrition, physical activity, and how to remain a really positive and active member of the community. This is my favorite part of the entire website, where they call it Make the Move, or Make Your Move, where they have all of these really cool exercise videos for different mobility levels. They have yoga, they have Tai Chi, dance classes, and we can really modify almost any leisure activity to make it an appropriate intervention to help with all of those positive benefits we just talked about. On the right here, you'll see some PT webinars that expand on knowledge of joint and muscle health, physical activity and fitness, just like answering a lot of those PT questions that you might be interested in. The tech seminar was particularly interesting and heartening to know that technology and AI isn't only going to kill us and can actually help us a little bit. All right. So how do we start? Like what are some thought processes we can go through? Oftentimes, I have patients who just kind of struggle with barriers. You know, there's a block, there's something that they're worried about, and they can't even put their finger on it. Some things like this Barriers to Being Active quiz that's on the Playing It Safe website all through the National Hemophilia Foundation can be a really good place to start. This is a 21-question quiz focusing on kind of the efforts of improving physical activity. So you go through these questions, answer them, and discover which section is kind of the biggest barrier, the biggest hurdle for you. And they separate it from the time issue, the fear issue, and many others. And it can really focus in on some self-reflection and really help understand what tools you might need to get over some of those issues. Your healthcare team or your bleeding disorders community can certainly help with this. Once we figure that out and address those barriers, now what do we do? You know, I might enjoy certain activities, but what if I don't really know what to do and I'm a little nervous about starting? You can look to this physical activities rating scale within Playing It Safe to determine, it's kind of a risk assessment for many different activities. This list is extensive on the website, and they rate these activities from low risk in the green, which is like, you're good to go, try it with a friend, to high risk where, oh my gosh, talk to every healthcare provider before you do this, and maybe please don't ever. So going through this list can be like a nice starting place. It also takes a deeper dive into each one of these activities with an overview of the activity, what it's all about, what you might be participating in if you went into it, the risks inherent to the activity. Oftentimes there are not many, but some of them have extreme risks, like the motocross, which nobody should do, please. And then the safety measures. If you really need to get on that motorcycle, what safety equipment do you need? Protective equipment? Who needs to help educate you on that activity? And then the significant importance of being very communicative with your healthcare team, of factor or platelet coagulation therapies beforehand, and how we address that risk. Okay, back to the World Health Organization. In that same updated guideline study, they also suggest different activities for patients who have bleeding disorders with and without joint arthropathies. Because just because you do bleed doesn't mean you have bled before. So there are different activities that are appropriate for every level and stage of hemophilia, Glanzmann's, and so on. I'd briefly like to bring up a case study of one of my dear patients who we see in our hemophilia treatment center. He was so excited when I asked him to be a part of my talk because he is such an advocate for physical activity and health and wellness in our community. Chris Bombardier is a patient who has hemophilia and has been a very active person his whole life. He has been good and bad about his factor replacement therapies, but during this process of learning and growing with this disease, he's known that with years of training, perseverance, and the direct support and communication with his healthcare team, he can achieve anything. Chris is an active hiker and became a mountaineer in his young adulthood. And with his connection with Save One Life, an international nonprofit that provides direct financial aid to patients with hemophilia in developing countries, he thought of an amazing fundraising task of kind of climbing the 7 summits, which are the tallest mountains in each continent. Now, he was the first person with a bleeding disorder to ever summit Mount Everest and many of these mountains on that list. The film Bombardier Blood chronicles this amazing journey and highlights some of the inequities of factor replacement and healthcare access issues for people who have bleeding disorders around the world. He will always say, the bleeding disorders community is the biggest inspiration he has. Yes, he likes climbing mountains, but supporting this family that he's surrounded himself with and promoting the physical activity and abilities of everyone is his main goal. So I had to talk about physical therapy. PT can be such an integral part of your physical fitness journey. So I'll briefly go over what PTs usually do, either in the hemophilia clinic or in general. We're usually reactive, right? We're oftentimes assessing joint or muscle dysfunction. If something hurts, you come to us, we try to help you fix it. We also promote the management of any bleeding episodes and help reduce with that, protection, rest, ice, elevation, all that good stuff. We help rehabilitate, strengthen, and mobilize those joints or muscles that were impacted by the injury. And we're in constant communication with our hematologists and nursing staff, with your coaching staff, and with the pediatric patients. We're kind of always back and forth with the schools, and then just ongoing education for families and patients alike. I would like to argue physical therapy can also be proactive. So beyond recovery, what can we do? PTs can be utilized as a regular joint health and function assessor. So we can do that through our regular physical exams on a timely basis. We also have the ability now to provide point-of-care musculoskeletal ultrasound imaging to assess joint health and function year to year, month to month, and adjust exercise routines as needed based on what we find. We can update orthotics, braces, any other assistive devices to keep you moving safely as long as you possibly can. And with our aging population, we always have to be critical and assess risk of falls and overall safety. So the last thing we want you doing is falling and becoming immobile. For providers out there, please consider PT as a proactive approach. Don't wait for your patients to be sick or ill or hurt to utilize our services. We are movement specialists that can maintain movement. So in summary, why are we talking about all of this? There are so many factors at play when we're thinking of our population living longer and hopefully more active lives. But with this comes some challenges, like those age-related concerns in the cardiovascular disease, those increased incidence of obesity, which all of that can lead to the increased risk of musculoskeletal impairments and hemophilic arthropathies. For all patient populations, including those with bleeding disorders, there are major health benefits of the strength in the cardiovascular health. We are looking for moderate to vigorous activity level as the most beneficial for all of this. We want that diversity of activity where strengthening and aerobic conditioning is important. And we want to encourage all of this from a very early age. Make those patterns, and it's no longer work or effort. It's fun and what we're looking to do with our free time. The bleeding disorders community specifically will also benefit from added balance and coordination activities, flexibility training to retain that proprioception, and targeted functional activities as well. And finally, we really need to have that individualized counseling prior to and during any physical activity. You have access to physical therapy, your healthcare team, your hematologists, nutritionists, whoever it may be, to help promote that motion. I hope today's talk has given you some insight into some of the amazing benefits of physical activity and some new places to begin or expand this lifelong journey of wellness. I would love to take any questions.
Proactive approach. Is it covered by insurance?
Good question. Yes. So again, for the providers that refer, we are not direct access yet. Should happen at some point, but with a referral from either a primary care provider or any of your healthcare providers to physical therapy for whatever you're looking for will be covered and is appropriate. And we're seeing those in studies, and we're seeing this kind of anecdotally where sometimes I'll have patients come in who were injured but felt fine by the time of evaluation, and they're like, I just want to make sure this doesn't happen again. I love those patients because I won't see them again. It will educate and kind of make sure this is, the musculoskeletal system is as it should be, and answer any questions they might have. Right. Oftentimes, if there is a physical therapy referral, it is covered, period. It's not directly through any of those organizations. All you would need would be a referral from a provider who can write them. Primary care, orthopedics, whoever it may be. Hematologists. I get my hematologist to write me scripts all the time.
I have a question back here.
Yeah.
So we've seen over the years, a lot of our parents will talk about their younger kids who are probably within the age range of like 5 to 10. They will have the typical, leg pains, growing pains of being that age, but it'll be so severe for some of these GT kids that they are laid up for days. Is there anything that you can recommend to help during that time? Because I know a lot of them, they do look to see if there's a joint bleed, and there isn't one. So it's kind of like, we don't have an answer, just rest. So,
right. Again, my adult brain is trying to answer a PD question, which is totally fine. But yeah, there is no reason to just lay around and tolerate that. gentle massage, heat application with gentle static stretching, gentle movement patterns, activity like a bicycle, like a stationary bike, can all be beneficial in helping with those growing pains, because those bones are growing really well, but the muscles need to catch up a little bit, and that's where we feel those symptoms. And it can be bone specific as well. There are some other modalities like TENS units that are completely safe and effective to use for kind of these chronic non-focal pain issues. But again, great questions for a local PT, and is certainly something I would say is pertinent, because no person should have to just deal with pain.
Thank you for asking that. That was one of my questions. I also wondered if the imaging that you referenced, is that more sensitive? Because when my boys have joint bleeds, I've been told, like, if you catch it exactly when it's happening, perhaps an MRI will see that. And we've never put them through that because they are so little, and the chances seemed slim that they would actually catch it. Ultrasounds didn't, for example. But is the imaging that you referenced different and more sensitive to actually show where the bleed is?
Very much so. And that timing piece that you referred to is really critical. We're currently working to get an ultrasound unit in our clinic, so that is not part of my practice now, but having gone to some continuing education courses out on the West Coast where they use it all the time, and do a ton of research on it, they'll have a patient call up, hey, I banged my knee, or my kid rolled their ankle, it's swelling up like a balloon, we just need to come in. They get that ultrasound head on it. Oh, it's just, there is some fluid around it. It's not blood. We're going to treat it conservatively this way, and we're good, versus, oh, that is intra-articular blood that we can diagnose based on the colors and other kind of factors that we're educated on. We need to get in with the coagulation therapies. They don't do this a lot, but potentially aspirate. There are two different treatment tracks that we could go on to both conserve factor replacement therapies and use them when appropriate, and then kind of just, again, helping with the overall outcome and the speed at which we're recovering. Because the longer that blood is in there, the worse it gets.
The strength and resistance training.
Yeah.
Is there an ideal age to start that, or maybe not start that?
That is a great question, and I don't know. That is a little teensy bit out of the scope, but it's so important, right? And a skilled pediatric physical therapist would know that right off the top of their head. But it's a great question to start that process with, right? Because sometimes they're too young, right? We want those growth plates closed. We don't want to stress any of those structures because we want them to grow as big and as strong as they can before we start really loading. And because it's a good trauma to the area where we're kind of building things back up, but we don't want to slow down that process with too much activity. Yeah.
So a lot of us, when we came here, we took a plane, and so we're confined to this seat. And I guess people with Glanzmann, they may be confined to the bed or a chair. And are there exercises like what? I don't have GT, but when I'm on the plane, I don't want to get a blood clot, so I like to jump around anyways. But in my seat, I move my legs and things. So is there something they can do? And another question is there a website or something we can access to read this information, to remind ourselves?
Yeah, it's a great question. I think your initial thought process of just keeping moving, keeping that muscle pump action available is number one. Many of my patients will also wear compression socks, like kind of the knee-high socks, that can help with lower extremity swelling or risk of blood clots. Oftentimes that should not be a concern in just the general population unless there's a significant medical issue or you've had one in the past. But some of those things utilizing our own muscles to pump and recirculate that blood is the best idea for something like that, where you have to be in one position for a long time. As far as a specific kind of place where they have all that information, I'm not sure. I would certainly start with some of those websites I had up there. You know, National Hemophilia Foundation would be a great place to start to kind of look for that.
Mhm.
Yeah.
You mentioned the vascular line. That is stronger on the artery.
It could correlate to that, but that more specifically relates to the vessel's elasticity, the vessel's ability when we're kind of exercising or having to have our heart rate increased. That stresses our vessels a little bit. They have to comply and expand for those that increased blood flow. When we have some more fibrosis of that tissue with inactivity or disuse, it gets a little bit harder to do that, a little bit more constrictive, which then increases blood pressure on everything. So if we have that compliance, it can kind of adapt to what we need it to do. And that improves with aerobic training. Thank you so much. Excellent.
Got it.